Dr. Andrew Iliff. I'm originally from Kansas. Any of you, hardcore MU Tiger fans, please don't hold it against me. I'm slowly working on my affinity towards MU. Not entirely there, but I'm working on it. So I'm married to a pediatric anesthesiologist in town, and then have two kids, 4-year-old, 2-year-old, and then went to med school at the University of Missouri, Kansas City, then residency once again there at the University of Kansas, and then University of Iowa for fellowship. And then I'm board certified in medical oncology and in hematology as well. So just real quick, just talking about Missouri Cancer Associates. So we've been open for 40 years now. And on site, we have just a brand new linear accelerator that we've just built in the last few months. We have an on-site pharmacy, and then obviously infusion for chemotherapy and immunotherapy and things like that. There's 6 medical oncologists. We're going to be adding a 7th next year. And then within the group, there's 7 radiation oncologists, 2 primarily that work at our site in Columbia, and then 3 nurse practitioners. And then we're partners with the Urology Associates of Central Missouri. And then all of us are board certified in oncology and hematology. And then our main hub is here in Columbia. We also have outreach clinics in Marshall and Kirksville, which are pretty major clinics. And then Moberly, we have a smaller clinic, which is just really benign hematology. So the purpose of what we're here for is that these are kind of some of the questions that as we go through that hopefully we're able to address. And really, I think this is really the motto behind Galleri, and that's just that cancer doesn't wait. So why should you? And these are some of the questions just kind of as we go along, we'll dive into that are you at risk for the development of cancer? We'll talk about that. And then do you have a screening plan in place? And then what can we do today to try to be proactive about that cancer screening? So the need is really related to this multi-cancer early detection test that we know, and we'll talk more, but we have some screening tests for cancer, but they have their limitations, right? So is there a way that we can be more proactive, screening these cancers earlier, finding these cancers earlier, and then being able to intervene on them as well? So what is Galleri? So Galleri is a blood-based test, which is a multi-cancer detection test, which is really the first of its kind. That there are other companies that are obviously, following behind Galleri, but are significantly behind, and none that have the sort as much research as basically as Galleri does right now. So it's a single test which is able to screen for 50 different types of cancer. These include the fast spreading kind of devastating diagnoses that we talk about, that unfortunately I'm sure some of the people in the audience have loved ones who have had, pancreatic, ovarian, or other cancers that we just don't have good, screening tests for. And the Galleri is able to screen for those tests. And another thing is that what really Galleri does is that it's looking for active cancer today. It's not looking for if you have, a family history or some genetic, predisposition for the development of cancer. It's not looking that, hey, what is my odd 10 years from now, 7 years from now, or something like that for the development of cancer. It's really that at the time that you had the blood test drawn, do you have that signal for cancer? And sorry, I'm going to take a sip here. As you can hear, I don't normally have this baritone voice. So one thing that I think is important that we're just upfront about is that right now insurance does not cover Galleri, and Galleri costs $949, which I fully recognize is not a small out-of-pocket cost. HSAs, you can utilize that for it, but $949 is a significant cost, and we'll talk a little bit about why insurance isn't there yet as far as covering the Galleri test. So as I mentioned earlier, that only 5 cancers really have a test that's able to screen for cancer. So as women in the audience would know, for breast cancer, we obviously have mammograms and pap smears. For colon cancer, we have colonoscopies. And then for prostate cancer, we have PSAs, and then nobody's favorite, the digital rectal exam. And then for individuals who have a big smoking history, they can qualify for a low-dose CT of their chest for screening for lung cancer. But that's what we've got as far as screening. That we don't have the ones I had mentioned earlier, your pancreatics, your ovarians, uterine cancer, that we just don't have a screening test that can find those cancers at early stages. So that's really when we end up diagnosing somebody with pancreatic cancer, it's because they have a symptom related to it. That something has happened within the body that's starting to set off alarm bells. Every now and then we kind of serendipitously stumble into these things, but by and large, this is just something that we find generally when the disease has gotten some pace to it and moved along a little bit, which is really what Gallery's purpose on this whole thing is. So finding cancer early should intuitively lead to the best outcomes. And we know from retrospective data that when you're finding patients with stage 1, stage 2, whatever type of cancer, generally speaking, stage 1 or stage 2, that those patients are going to end up doing a lot better than the patients that have a stage 3 or a stage 4 cancer, which I think all of us just intuitively that makes sense. But retrospectively, we've got good data showing that. There's no doubt about that. Whatever type of malignancy you're talking about, that by finding it earlier is going to end up leading to better outcomes. It goes back to the insurance question, because that's really where for insurance to be covering something like this, they're going to want to say that are you in fact saving lives? And Galleri is working on that data right now, that we have great data from Galleri that they're able to find these cancers at earlier stages. But from an insurance perspective, they want that next step saying, hey, have you proven that you're actually saving lives with this test? Which I feel confident it will bear out, but it's not there yet. And that's why insurance and Medicare is going to be holding off on covering the test, which is why we're really excited to be the ones bringing it to the Central Missouri marketplace as the first people that are offering this test, which I think is going to be a game changer in the long term. So this was always a question that stumped every, first year med student. When they would talk about epidemiology of cancer, the professor would ask, so what is the biggest risk factor for the development of cancer? And, somebody would jump up and down and say, it's obviously smoking, and then say, no, that's not right. And then what about asbestos exposure, right? And sure, asbestos certainly increases your risk for the development of cancer. Or alcohol or any other things. They can be lifestyle things that would increase your risk for cancer. But unfortunately, the biggest risk factor for cancer is the risk factor that none of us have any control over on this earth, and that's just your age. And that we know that if you look at people over the age of 50, that they have a 13 times risk for the development of cancer as opposed to those that are younger than 50. And once again, I'm sure a vast majority of the audience has some family member that has been diagnosed with cancer, and that occasionally those are tragically the young people, but most of the time those are people in the 50 plus community. So then once again, the earlier you know, the sooner you can act. So around 70% of cancer deaths are really related to some cancer that we don't have a good screening test for. So in that partly speaks to, to the credit of mammograms and colonoscopies, that they're able to find those early early cancers and then screen those, intervene so patients can go on and live their lives. But a vast majority of cancers, we just don't have a screening test for. So this introduces Galleri, so what is it? It's a blood-based test that screens for the presence of cancer. So looking at, 1 second. So what it basically is a multi-cancer early detection test, blood-based test, which serves as basically an adjunct to our current recommended screening tests. So Galleri really is not meant as a substitute for individuals to be getting mammograms, to be getting colonoscopies. It's something that can really jump on top of that and add that extra supplement that can be finding those additional cancers. It's an easy test. It's a blood-based test. We've all been to a doctor before. We all get our blood drawn on a regular basis. And this is no different. It comes in a fancy looking kit. And but you don't have to, fast for it. We aren't checking your cholesterol. So no fasting, no preparations needed. And then can gives you that proactive information that allows you to see whether there's a signal that was detected or not. And we got a great question that we're going to address here in just a minute. Perfect. 2 great questions that we'll cover here just in 1 second. So how does the Galleri test work? And this is really, as somebody who kind of is a little bit of a science nerd, is what's really exciting about the test. And I think if you walk back and look at how the test initially started, and I don't know how much of this is apocrypha or truth, but I don't think that Grail is the name of the company when it had initially started at Science, that from my understanding that they were doing prenatal testing. So looking at prenatal DNA, and in some women who were pregnant, they found an abnormal marker. They didn't know what that meant, but they followed those women along, and unfortunately, those women ended up being diagnosed with cancer in the next year or two. Which at that point, that obviously sent off a signal that what are we finding that we need to be replicating elsewhere? Which when you think about the history of medicine, this sounds almost serendipitous, but that's a lot of medicine. That's a lot of science. Is that you start off with your hypothesis and you want to answer a question, and then by the time you're done, you have an entirely new question and an entirely new answer. And that's serendipity, but I think also is penicillin was kind of the same way, that we just stumble into these things and then it ends up changing things long term. So what it's looking at is the blood drawn. DNA is obviously in blood, and it looks at methylation patterns on that DNA, which can basically send off a signal. Certain methylation patterns are indicative of the presence of some sort of cancer. So just that simple blood test can hold a signal in it that says, yes, there is a cancer hiding somewhere in that person's body, which is obviously very exciting, from a science standpoint. And so those methylation patterns, and then we'll talk about it a little bit more, but the methylation patterns, it's even cooler than that. It isn't just, hey, I think this person has cancer. It actually can say, yeah, I think this person has cancer, and I think it's pancreatic cancer. So it's able to pinpoint it pretty precisely where we're worried about, which allows, me as a physician to really scope in on where are we looking, and what are we doing here. So who is Galleri for? So we had a great question from the crowd that asked, so who should be doing this test? So our recommendation right now is going back to that initial risk factor of people over the age of 50 are going to have the biggest risk for the development of cancer. So people over the age of 50, I think that if this is something that you are interested in, then by all means, that would be something that you could pursue. And then people under the age of 50, that if you have certain risk factors, let's say you're a big smoker, and on our website, we're going to have those listed out. But having a significant heartburn history, even significant alcohol consumption, those are all risk factors. So anyone, I would say, over the age of 35 to 50 that has those risk factors, I think it's very reasonable to look into getting that test. Over the age of 50, then I think anyone, regardless of kind of your background or cancer status, you would be somebody that would qualify. I do think it's important to say that there are some people who should not get this test. People under the age of 21. The risk for you developing a cancer under the age of 21 is just very, very low. So I don't think it makes sense. If you're pregnant, this is not the time to be screening with this test. You've got other things going on right now, and then other fantastic things going on right now. And then anyone who has had cancer really in the last 3 years really shouldn't get this test. That's a whole different space of medicine, that idea of what we call minimal residual disease testing and things like that, which is its own field that's growing, but really I wouldn't recommend Galleri testing for somebody who's had it within the last 3 years. And then I'm gonna jump to a question real quick. Yeah. But there was a question about so the test can tell you where the cancer comes from. So it can say, was it pancreatic, lung, kidney? And then we'll go through a list here of all 50 malignancies. But when you get a positive test result, it says, yes, you have a positive test result, and the positive test result looks a whole lot like a kidney cancer, or whatever, the positive test result ends up showing. And that really goes back to that methylation patterns, that different cancers have different methylation patterns on that DNA. So then they can look at it and say, well, this methylation pattern lines up a whole lot like an ovarian cancer. I'm just making that up. But yeah, it can actually do that that specifically. So as far as the testing process, if this is something that you're interested in, so requesting the test through in Central Missouri, Missouri Cancer Associates is going to be the only one offering this test right now. As far as, an offering to the general public. So you can do that through our website. We're also going to talk about, we're going to have a draw event at our facility on Thursday, if that's something you wanted to. But that blood testing is done at our facility right now, just from logistics standpoints and things like that. And then, so you would go to our website, fill it out, and then our office would contact you, schedule an appointment. We're very flexible as far as appointment times. Generally, what would happen is you come in, I meet with you, make sure we're all on the same page about drawing the test. Especially while it's new, I think it's important that we just have a little bit of face-to-face time to make sure that everybody's kind of on the same page. And then then you can get so then what would happen, we draw the blood test there, and then results end up coming back about 2 weeks later. So, and then complete your blood draw. So these can be drawn really just at Missouri Cancer Associates right now. But once again, simple blood test. You come in, fill out the paperwork, phlebotomist draws the blood, boom, you're on your way. And then, I mean, payment is obviously involved. So let's talk about what actually happens. So you got your blood test drawn, and then that gets sent off to the Grail's lab. And then it takes, 2 weeks is what we say. Sometimes it's a little bit quicker than that, but 2 weeks from that, you end up getting your result back. And then you get one of two results. The first is that no cancer signal is detected, which is going to be a vast majority of this, right? So 99 out of 100 tests are going to say no cancer signal is detected, which is obviously what we want. And in that case, we just say, keep doing your mammograms, colonoscopies, routine health screenings, things like that. And then if you wanted to, we could draw it again in a year. And alternatively, if there is a cancer signal that is detected, then once again, rare result, 1 in 100, maybe 2 in 100, somewhere around there, that it ends up saying it. And then they even give this cancer signal origin. So going back to that point where it says, it looks like this might be a melanoma of the skin, which allows me, is typically what happens in that situation is I would call you. If you have a positive test result, we talk about it and say, this is what we found, and I would like to order A, B, and C and start that process rolling. I'd obviously have you come in the office and we'd kind of talk about where we're going from there and things like that. So then going back to that point from before, that no cancer signal is detected, and then you could add Galleri to kind of your annual wellness screening if that was something that you were interested in. You should continue on with your normal things. And then if a cancer signal is detected, we talk about kind of next steps involved in that process. So we had a couple questions. So what cancers are detected? And here they are, which is a lot. So as they'd said, 50 plus different types of cancers. And so when you got a positive test result, it actually is able to say that this looks a whole lot like even appendiceal cancer, which is a very rare type of cancer, but it could be that specific, and then it starts pointing in that specific direction. And it obviously hits the big ones, your breasts, your lungs, your colons. But once again, not meant as a supplement, or not as meant as a replacement for your other tests, but it is able to pick up some of those. So and then so I mean, you could look through this list. It's quite extensive as far as what different, I mean, we're even picking up sarcomas and things like that, which are just very rare types of cancers. So here is, so on our website, you'd be able to find these videos that kind of talk a little bit about things. Let me stop here just while we're going to look, see if there's any other questions. So we had talked about that we can find these different types of cancers. And let's see. So, I couldn't answer that question specifically as far as, if somebody had some localized early stage cancer, within the last few years, would getting Galleri, uh, technically, I think they would say no, that it's not recommended in that situation. But I certainly see the argument. I think but for the purposes of this, that really would say no, that if you just were diagnosed with an early stage cancer, um, that really you should probably hold off on Galleri testing. And then how often that if you had a negative test result, repeating it annually makes more sense. I wouldn't say this is something that I want to get drawn once a quarter or so. That seems like a little too much right there. Yeah. So, and then somebody had asked about, so let's say a pancreatic cancer. So that's why it's helpful for me, because generally I would be the one driving that next step as far as diagnosis goes. That if it said pancreatic cancer, I know where I'm looking. I know, either getting a CAT scan, there's a test called an EUS, which is endoscopic ultrasound. But I'm able to utilize that cancer signal detected, and then I can kind of start marching in the right direction as far as diagnosing that cancer that way. And that's why it's really helpful. If it said, ovarian cancer, it's a totally different sort of investigation that we would end up doing. Oh, great question about false positives, because it's important that we do talk about false positives. And I apologize if I glossed over that. So a false positive would basically be that I had a positive test result, and then I do my initial diagnostic investigation. I'm not able to find that cancer. And that those do happen, which I'm, that a good chunk of patients who have a positive test result end up being diagnosed with a cancer during that initial investigation. But there are patients who have false positive test results. Typically, what we do, if it says cancer signal is detected, what we do is we do our initial diagnostic investigation. We dive into what's going on there. If there's no evidence of cancer being found, then typically Grail or Galleri is repeating that test 6 to 12 weeks later to see if we're still finding that signal and whether we need to still be digging into that. But every now and then they have a positive signal, and then the positive signal goes away. And that's just some of the mystery of medicine that we might not ever have a good answer for. But that absolutely is part of the question. To the best of my knowledge, insurance is not applying this to any deductibles. You can use it for HSA. It would count for that, but it wouldn't apply to any deductibles, or insurance really isn't recognizing the test right now. Right now, we're just going to be doing it in the Columbia office. I hope, depending on once we've kind of got it's relatively new. So I could see us opening it up to our outreach clinics, but right now it would be a visit down to Columbia for the blood test. But then, God forbid, if there's positive results, all that can be taken up locally. Somebody asked about, genetic testing. So that's a different test. Genetic testing, what we're talking about there, which I understand but genetic testing, we're talking about germline testing, which is the genes you were born with. This test is testing the genes you got right now, and whether there's a cancer signal there. But I think the question would be that if I had some, BRCA mutation or some other mutation that I knew about, then you certainly are at increased risk for these cancers. So it would make sense to potentially investigate. That it kind of makes more sense for this test in that situation. So questions, we're going to talk about that. While we do that, I'm going to bring up this. So this is the blood draw event that we're having on Thursday from 4 to 5 p.m. You could scan this QR code, and then that'll go to our website. You can book an appointment time, and we'll be doing it 4 to 5 p.m. on Thursday. I'll probably be there, and we'll be able to talk about it and things like that. But likewise, that's not the only time we're doing this. If that doesn't make sense for your schedule, we would have through scheduling and things like that, we can also book additional times. So somebody who had cancer 6 years ago, you're totally qualified that you would qualify for the test. That's far enough out that you could get the test. And then once a year is typically how often we recommend it. Somebody had asked just how often. I'm not sure whether you guys can see the questions that I'm getting or not. And then a great question that somebody asked is about that if I had a positive Galleri test, what does insurance say about that? And from my understanding and having lots of these conversations is that insurance is totally respecting a positive test result as a reason to go diving into investigating whether there's any cancer anywhere else. So it shouldn't be worried too much about um, if you had it, is insurance going to tell you no? The insurance should respect that. And there's no way insurance isn't going to pay for investigation. I'm confident of that. And then antigen antibody related testing. I guess it depends on how you define an antigen, but that I wouldn't really say it's not really like that type of testing that I think that you would be thinking of. And then let me see, just looking through. And so somebody had asked, I had uh yeah, so sorry guys. So somebody just asked about inconclusive genetic testing. I suspect that individual had like what's called a VUS, which is just a very undetermined significance. But typically we say that that doesn't mean that you're at increased risk for the development of cancer, but you still would qualify for this test, as long as you fell in those other risk factors. But yeah, you would qualify for the test. So yes. And then so yeah, insurance does pay for it. And then somebody had said that they were in their 70s. Would they qualify for testing? And the answer is yes. Yes, they would qualify for testing. So I'll leave it open for a minute. Thank you all so much for coming. This has really been kind of something that I've been really excited about. I've been thinking about for the last few years. I really appreciate the Galleri team has been very instrumental in kind of helping make this come to fruition, to offer something to the Central Missouri market in this. So we're really excited about that. I'll leave it open for any questions, but otherwise, I hope you guys all have a great evening. Oh, wait, one more question. The draw event from 4 to 6 p.m., we actually kind of changed that. It's actually 4 to 5 p.m. right now. If you have to come right at 5 p.m., that's fine. And then once again, if that draw event doesn't work for you, that's okay. Just talk to our schedulers, and that we can get you scheduled lots of other times throughout the day. So whatever works for you, okay? So somebody had a question. It's hard to say. 3 years, I would say if you're, if you were diagnosed with cancer 3 years ago and then you got some adjuvant treatment for a year or 6 months, then I think that totally sounds reasonable. We really just don't want people fresh off a diagnosis of cancer that would have it. So, but if you were diagnosed at 3 years ago and then you've been cancer free for 2+ years, I think that's a completely reasonable time to get that test. Okay. Yes. So if you can't come on March 7th, you can come absolutely. Just call Missouri Cancer Associates. There's also on our website, there's a thing where you can basically take a questionnaire. Do you qualify? Then that would get submitted to our schedulers. Schedulers would call you and we can arrange a time that would work for you. So, and we're pretty flexible with those times. So, all right. Well, thank you so much. I really appreciate it. And I hope you guys have a great evening. Anytime there's any, that our website should have a lot of information. But I wish you all the best. All right. Have a good evening. Thanks now.